Hi, everyone. Sorry about that. Just a warm welcome to everyone who's joining us this morning. It is very, very cold here in Johannesburg, so I'm hoping that where you're joining from is a little bit warmer and drier. We are having a very, very rainy Monday, but we are super excited to be able to present to you this morning on something that we are really, really excited about. And we are doing things a little bit differently. Generally speaking, we take this, this moment, and we generally draft requests and grant requests, etc. But this is something that we're so excited about, and we really understand the value of collaboration when it comes to analyzing any form of data, and certainly when it comes to making data available. So we wanted to do this a little bit differently and to open it up to everybody who we have requested to join today. So we're really, really excited to be able to join this. I have just got a message on my team to say that everything is working their side as well. So we are ready to start. What I'm going to do is I'm going to run everybody that is joining us this morning through a short presentation, which will give a little bit of detail around the project and essentially what we have tried to achieve and the reasons for doing it. And then afterwards, I'm going to open it up to a Q&A. And please, during that Q&A session, ask away. I think it's really, really important that we get this right from the beginning. So if we have neglected certain elements, possibly not thought of something, please certainly do let us know. So if you just give me 1 second to get the presentation up and going. Right, so a little bit of an introduction to the Rare Registry this morning. So, right, what is our vision? Our vision as Rare Diseases South Africa is obviously a South Africa where those that are impacted by rare diseases and congenital disorders have access to life-saving therapies and support for improved quality of life. And this is a very, very broad statement, and yes, in an ideal world, we'll get there. But really, for us, it's about improving quality of life, and it's about understanding that sometimes really, really simple interventions go on to really make massive difference to patients, and it doesn't always have to be as complicated as we think it does. So what was the need in the background to us developing this registry program, and essentially, how did we get here? So the first thing is that we know that the lack of knowledge and awareness and quantitative data has a negative impact for patients. And it makes it really, really difficult from us, from an advocacy perspective, to be able to drive change, particularly when it comes to policy. So we are always being asked, we know that there are approximately 4 million South Africans who are impacted by a rare disease who are living in South Africa at the moment. And we would really love to be able to have them accounted for in some way. And whenever we are in discussions with funders or policymakers or the Department of Health regarding budgetary allocations for rare diseases, we always get the pushback and the feedback. Where are these patients? And it's really, really difficult to quantify and determine where they are because nobody's actually tracking and tracing them. We know that we have relatively poor surveillance systems when it comes specifically to rare diseases and congenital disorders. And as a result of that information not feeding through to the right information systems, these patients are generally not accounted for anyway. And having that access to that data and knowing and being able to account for these patients really helps support policymakers who are trying to make decisions around healthcare and budget allocation. So it's more than just having access to data. It's more than just understanding where these patients are. That determination, knowing where these patients are, how they're being treated, what investment is being made, where are the gaps, really goes on to improve the policy and legislation as well. So we did a little bit of a needs analysis, and in doing that, and in part of our process, in terms of how we were going to design this registry and understanding the need, we knew that we wanted to do a couple of things. We had to undergo a literature review to understand thoroughly the true definition of a patient registry. Is what we thought of from a patient perspective, is that what is actually a patient registry? Then we wanted to get a support group wish list. So we wanted to find out from our support groups what it is that they would like to see come out of something like this. We wanted to have a review on existing registries and an understanding on what was available locally as well as on a global perspective. And we wanted to undertake a couple of user interviews to determine from a patient perspective, what are the current gaps in them actually using and utilizing registries. And the information that we got back was quite interesting. I think the first thing that needs to be touched on was in terms of the dependency on clinicians for registries to be successful was something that we knew to be true and was relatively evident from the start. So there are existing registries in South Africa for particular diseases or particular groups of diseases. For instance, hematology as a collective, etc., similar to what the cancer surveillance and the cancer registries are. But what we knew was that those registries require your doctor or clinicians actually being able to have the time to be able to input into those registries. And that's often where the difficulty lies, particularly if you're looking at the under-resourced state departments. And even in a busy medical practice, very, very often clinicians don't have the time available to them to be able to continuously make use of these registries. And as a result, what the research showed and what we found was that on launching of these registries, we had initially a good group of patients being loaded, but then subsequently that frazzled down and the long-term use was quite poor. So we went and did some research with regards to a definition, and the definition of a patient registry was defined as an organized system that uses observational study methods to collect uninformed data to evaluate specific outcomes for a population defined by a particular disease, condition, or exposure that serves a predetermined scientific, clinical, or policy purpose. So from this, we understood that we were correct in thinking that it doesn't only need to be from a clinician's perspective or a clinical perspective, that these registries can very well be used to drive policy change as well. And that was a great tick box for us because it was something that we knew that we wanted to be able to use this information for. With regards to the interviews that were conducted from a user interview perspective, so in speaking to both support groups as well as patients who we would like to see benefit from this registry, a couple of things became quite apparent there. And that the first was that patients often explain that their journey to a diagnosis is a difficult one. Very often clinicians are not familiar with their condition and their condition and their symptoms, etc. And as such, they are not often adequately managed or accessing highly specialized teams. And very, very often you require a highly qualified specialist to be able to make the diagnosis. So that was the one thing we knew, that the diagnostic odyssey still remains long and quite difficult. So what we knew from that is that we wanted to be able to include those who have been undiagnosed in this registry as well, so that it wasn't only for patients who've been diagnosed, so that the undiagnosed can also still be counted, but that also as further testing becomes available, as new evidence and evidence-based medicine becomes available, as new research gets done, that we could go back to those patients and say, look, something's come up, you may want to speak to your clinician about being retested for this particular condition, A, B, and C. So we knew that that was what came out of that particular element. Then with regards to being able to document their journey, it was very important to users that they could actually do that. And there was an overwhelming need to keep record of all your visits and changes in management. So from this, what we understood, and we can speak to this from a personal perspective as well, is that very, very often patients are seeing a multitude of clinicians. So they're not only at one doctor. In the rare disease space, you have on average 7 different clinicians treating a specific patient at any given time. And as a result of that, patients have fragmented information across a variety of clinical files. In the private sector, it's actually worse than it is often in the state sector, in the sense that in the private sector, you might be seeing your cardiologist who might be at Sunninghill Hospital, and your pulmonologist is sitting at Mill Park, and you might have your psychiatrist in a completely different clinic. And as a result, they don't often speak to each other because it's cross disciplines and it's also cross hospital. And what happens then is that you might be driving your healthcare costs up by going for a same test more than once. because they've been requested by different clinicians, not knowing that the test's already been undertaken. You obviously have a lack of collated information, and really very often we find that no one is evaluating the patient's case from a holistic perspective. They're only looking from their particular discipline. And that obviously has a negative impact on the patient's outcomes and obviously their overall quality of life. So what we knew would be necessary was to find some way in which a patient could take all their information and keep it in one place. And that was very, very important, but also that you could track certain things. So for instance, you might be on a treatment at the moment that is the only treatments available to you. There's no other treatments around for you, and it gives you a rash, but because it's the only treatment, you use it. 5 years from now, something new might come to the market that has a lower risk of developing this rash, and now you need to motivate to be able to have the switch in therapy or to move on to this new therapy. But because no one's actually documented the side effects or the rash, etc., or you can't actually show clinically how long you've been experiencing this, now all of a sudden you're prevented on being able to move over to this newer treatment because a funder might not be willing to pay for it, etc., because it's not on their formulary, because it's newer. So keeping track of that information is very, very important. We also understood that patients really only book a follow-up appointment a lot of the time when they are not feeling well. So you might know that you have to go to see your clinician twice a year, or once a year, whatever it might be. And it only really, when you start feeling, you're not feeling so great, you're picking up side effects, you're not finding you having the same response to treatment, etc., you book an appointment. So when your doctor asks you how you are feeling, you really only give them the recent 2 weeks worth of feedback, and it's generally negative feedback. So it's very difficult to track actually over a period of 12 months. How bad have you been experiencing symptoms? Has it been every day? Have you been in pain, more than 8 out of 10 every day? Has it only been recently? So it's often very, very difficult to remember things in detail. And so to be able to track those sort of events was very, very important to patients. And then also patients reported that their mental health and well-being was also very important and was being neglected. So how are you doing emotionally? How are you coping? How are you managing with living with this day-to-day condition? How do those things all impact? And it's important to remember that a patient who's overall healthy and who's being managed holistically, there's always much better outcomes. So those patients generally do better. So monitoring mental health, etc., is exceptionally important. But because we generally are focusing on the symptoms of the condition, we neglect to remember that we're treating an entire person. And as a result, those things fall off the wayside. So those were 3 really important things that came out of the user feedback sessions. Then we also determined that linkaging to a biobank was of a critical importance, specifically to undiagnosed patients, and also just to determine and develop and understand natural history studies, etc. So we've always had a fantastic relationship with Northwest University, and they have recently developed a rare disease biobank at the Center for Human Metabolomics in Poch. And their vision, the vision of the CHM Biobank, is to be the first rare inborn disease biobank in South Africa and Africa, and one of the first globally to focus exclusively on rare inborn diseases. And they also want to foster quality relationships with every person who is consented to donate specimens in this initiative. And obviously to obtain ISO 20387 accreditation. And they wanted to become the first biobank operational training center in the country, as well as in the continent. And these were all things that we found to be very, very aspirational. And they seemed like the perfect match for us. So linking back to that biobank is so incredibly important. If you've got samples, to have them being stored in a facility that's, where they've got ethic approval, and that they are really, really interested in doing the right kind of research that ultimately benefits the patients, is something that was important to us. And then the other element that needed to be considered was, can we do a website or should it be an app? And considering that our audiences, in terms of our users being patients predominantly, are both laptop and mobile phone users, it would make the patient registry more usable if it was an application on a mobile phone. However, a website is recommended as a first point, as this can be both accessed through a phone as well as a desktop and provides a continuity of data across multiple platforms. And then if you're looking into the future, which we like to do, this platform is to be extended to be used with healthcare providers, which I'll explain in a little bit more detail about now, and they would most likely access this registry via a laptop or a desktop more so over than using a phone. So we knew that starting with a website was the right approach to do first, and hopefully as time goes by, we can develop it into an app as well. So then we went through the process of developing a technical brief, and we were very, very lucky in the sense that we were awarded a grant from an MSD grant fellowship, where we were provided with 3 fellows, super brilliant women, who were able to come on board and actually assist us in this development and concept and strategic planning phase, which was really, really helpful. And from that, we were able to develop a technical brief. And we looked out for a fantastic partner who we found in the form of Health Cloud, who was able to give us everything that we needed. And we knew that these needed to be the focus areas. So user authentication, patient management, as we've detailed, running a robust and stringent database, being able to send patients notifications through this mechanism, for patients to be able to update their profile on their own and have that information sent through to a clinician for verification, as opposed to having the reliance on clinicians having to do those updates themselves, to be able to provide support, and to provide daily and consultation check-in support. We wanted to have a search functionality. So if your clinician, when you were at your appointment, said, when was the last time you had a 2 out of 10 pain scale, that you could go actually check. We wanted to have a calendar function so that people could track events. We knew that from a privacy and POPI perspective, it needed to be above board. And we wanted to be able to also have static information pages to be able to put the right information in front of patients that needed it. And obviously security and compliance were high up on the priority list. And this, ladies and gents, is what we have managed to develop. So I'm going to take you through a couple of screenshots of what we have managed to develop this far. And then afterwards, we'll go into understanding what we feel that the community needs from it, and getting a better understanding of everyone who's joined us today, what they'd like to see come from a patient-led registry such as this. So this is obviously what it's going to look like from the front. Patients will then be prompted to register on the registry. Once you've registered, you'll get a dedicated email that comes through saying, thank you very much for registering. This is incredibly important, because this will be ultimately where we want patients to come back and give us feedback. So developing that relationship with them and having them understand that this is more than just a once-off signing onto a registry and never hearing from us again, that we are actually there to try and improve their patient outcomes in the long term as well. This is a little bit of detail around the types of questions, etc., that will be asked on that registry. Obviously, we want to know, understanding that we have lots of minors as well, who the primary patient is, what their details are. We obviously want to get consent for them to get information around things like the biobank. Can we share information with their healthcare professionals, what we can and can't contact them about. And then this is a little bit of the calendar mechanisms. So it is possible to actually book your appointments, to load them up onto your calendar so that you can see when your next appointments are coming up, and to track those events, as well as to track things, if you're having surgeries, if you're needing to apply for authorization, when your script needs to be renewed, etc., etc. An important element was being able to upload documents. And we wanted this to be a very, very broad thing. So understanding, it's something that became very, very apparent during last year's riots down in Durban. When all of that was going down, we had patients who couldn't access their chronic medication because they didn't have copies of their scripts. The pharmacies had burnt down, or they'd been destroyed. We had, the centers were closed, logistic lines were shut down. You couldn't go to your general pharmacies, etc., to get your medication. And patients actually, so we were now trying to, reach out to other parts of the country, that weren't experiencing those challenges to be able to try get medication through to our patients. But without having copies of something simple like your script makes it really, really difficult. So this is intended so that when you're at your doctor's rooms, you can take a quick snap of your X-ray report or whatever reports in front of you, your blood work. You can keep copies of your invoices if you need to for claims purposes. You can take pictures of all your scripts and all of that and keep it in one consolidated place that it's indexed and that you are able to find it should you need it, which is a fantastic resource. We've also developed this mental health check-in and this wellness check-in. So this is, they'll be prompted or they can do it on their own, where you are actually able to track your symptoms. So how are you feeling today? Are you in pain? What sort of symptoms are you experiencing? How they're manifesting, etc. Give a little bit of a description. And this is also very, very important when making treatment changes, to monitor how the patient's response has been to treatment. So, have you started a new treatment? Yes. Okay, well, over the last week, I started it on Sunday, and for the last 5 days, I've experienced this continuous headache. Might be worth touching base with your clinician. This is the search functionality which we've included. So if you want to see information from your last appointments, etc., this is where you can go and do a quick search. You can search something as simple as a headache or your service provider, or many of our rare patients have more than one condition, so you can search for stuff around a specific condition. And then obviously we've got with regards to just tracking of posts. So those posts are if they want to just keep track of, certain things that their clinicians can also have access to. And the intention is that obviously I want to say this is the basic version. It doesn't seem so basic, but it is still quite basic. But the intention for this long term is that we are wanting to be able to develop a mechanism where patients can search and find their relative clinicians, and that clinicians will be able to feed information from their side into this as well. But that will obviously be the next phase of this development. So this is what we've managed to do up until this point. And now we're coming through to you as our community members, and as well as industry and our sponsors and partners from around the healthcare systems, to assist us and tell us what you would like to see come out of these registries. Have we left anything off? And then also to just detail you through what the costs are going to be for us to get this over the line in terms of the next sort of phases of the build. So at the moment, this is what we've managed to do. We have completed phase 1, which was the concept and strategic development, and that was thanks to a grant that was provided by MSD. And through that, we've managed to do the concept development, the strategic plan based on the research and analysis, as well as the full costing. And that we ran through from June to September of last year. Then phase 2 is the technical analysis and design stage. And that is what you have now seen that has been completed. We've got the wireframes, we've got the design, we've got the functional specs all finalized, and that's already been covered. And now we're moving into phase 3, which is actually going to be the development of the website. And that is going to come at a cost of approximately 350,000 Rand. And that will be for both the front and back end development, as well as the quality assurances. And we anticipate that will take us another 3 to 4 months to get finalized once funding has been approved. So we're hoping that we can get funding to be able to do that. This will still be a website, but it will be mobile responsive. So you will be able to log in, etc., off your mobile phone. It is just not going to be an app at this point. And then going forward, the future plan costs will be the addition of the clinician module, and that is to be able to do the clinician integration, where you're able to find and load your clinician, you're able to do automatic file sharing, you're able to print your files, etc. And then after that, obviously the app development, and the app development is exceptionally expensive. I think anybody who's ever had anything to do with app development knows that it is quite a costly and quite a costly exercise. And then obviously with regards to maintenance costs, the maintenance costs work out to about 7,800 Rand per month going forward once it is launched. And with regards to that, it works out to approximately 95,000 Rand a year. And we are hoping to get those covered from both advertising. There is some retail space built into the web design platform, as well as through sponsorship once we have developed some form of trajectory in terms of being able to show the impact that this registry has had. So just quickly want to say thank you to the following, obviously MSD for providing us with the initial grant that has allowed us to actually take the time and resources to develop what we have this far, as well as Northwest University, who's been a fantastic sounding board to us, and particularly with the biobank implementation. And then obviously to our tech support, who's Health Cloud, who's developed what you've seen today, as well as Pinotage Advisory and Salesforce, which is ultimately where everything will be housed. So with that, I'm going to ask if anybody has any questions. If you do, I would like it if you could please ask via the Q&A section, because that is ultimately where I will be able to see it on the screen. And for some reason, my mouse has just stopped working. So let me do that. Lovely. My mouse has just decided to stop working. But I do see we have, sorry, someone has asked, is it possible for you to share the PowerPoint presentation with us? So I presume you mean like a email version, a PDF version of what has been shared to you today. Absolutely, we are 100% able to do that. So what we can do is send it out to all of those who've registered for this webinar, the attendees that are on here today, whose details we'll have, and we'll certainly be able to send that out. I'm not sure. I'm just checking to see if there are any other questions that have come through. I'm really hoping that everybody uses this as an opportunity to ask the necessary questions, because it's really, really important to us to make sure that we've got our partners involved from the very, very beginning, so that we don't end up developing, and going through the pain and agony of developing something that is quite intensive, only for it not to have any benefit to the entire community at the end of the day. So I'm just having a check. Will you be able to access the data in the registry in the future? Who will be able to access the data in the registry in the future? So I'm actually, if I can, I'm going to hand over to, I just need to add her on here. I'm going to allow, if I can, Helen Mulherber, who is our Director of Research. I'm promoting Helen quickly to be a panelist. And Helen, if I can ask for you to possibly answer that question. Helen's a lot more data and tech spec than me. Helen, over to you.
Hi, everyone. Sorry, Kelly, I missed the last bit as I was converting from a participant to a panelist. So
I was just telling everyone that you're much more data orientated than me, and that you'd be better to answer the question.
Okay, thanks, Kelly. So I think it raises the question that I was wanting to discuss around and speak to was just really who's going to be able to access the data going forward. And I just wanted to reassure all the participants that will be joining as patients. Everything is compliant with both POPI and all the other various legislation, just to ensure confidentiality and security of these data, and all of that is being undertaken as a part of the project, as with any other type of research project. And this whole rare registry is covered by ethics through the Northwest University, through our collaboration with the Rare Disease Biobank that's actually been set up there. So I just wanted to really reassure everybody that we are compliant, we are taking all the appropriate steps to ensure that this is both at the highest standard and compliant to any, to all and current and future requirements with regards to confidentiality. I think it's also one of the aims of the biobank itself, and that will speak to the registry as well, is the involvement of researchers going forward, because of course one of the aims of a biobank and an associated registry is to actually work together with research on specific conditions going forward. And we know that in many cases, while there may not be even a diagnosis or a specific treatment available now, that in 10 years' time, there may well be something with the move of technology and new treatments that have come through. So I think it provides a huge opportunity to actually start expanding research into the genetics and so on of African-based populations, specifically in this case, South Africa, where we know that globally a lot of the research has been done on the genetics and the genomes of European and, developed countries. And we're really lacking in that area. So we're really excited that we can go forward with this. And of course, it's a long-term project, but it is going to build a solid base for us to do research in that area.
Thanks, Helen.
Yeah.
I see that we have had a question, and I thought maybe you'd be best to answer it as well. Which university does the ethical considerations belong to?
So that is based with Northwest University, because with the addition of the registry to the project, an amendment was made to the ethical permission that was granted through the Ethics Committee at Northwest. So it is covered by the ethics of Northwest University at Potch.
And a follow-up question to that is, will there be any data sharing agreements? How will the ethics work through only one university?
I think that's an excellent question, and I don't have all the answers. But with regards to the biobank specifically, that's going to be dealt with directly with Northwest University for the biobank. With regards to the registry, we're still working out all the ins and outs of it going forward. But I'm sure there will be data requests and data sharing processes that will be employed just to ensure, fair sharing of data, but protection through an anonymity and falling under the ethics. So yeah.
And I think also it's a good point to raise that this is a patient-driven and a patient-led registry, and as a result of that, the information, for us, it's very, very important that patients are in control of their information and who uses it. So when those sort of requests come through, that they will also be shared with the users of the registry to determine that they actually, I think it's been one of the big scary things for patients, and it's one of the inhibiting factors, I think, for patients not having a willingness to be involved in a registry, is that how the registry is designed and the information and even the consenting is very, very high level, and it is designed obviously to fulfill a more, I want to say, a high level mandate. And it's not really patient friendly in terms of understanding and conceptualization, etc. So that's something that we want to avoid happening with this one. And we knew that if we provided patients with the ability to be able to track their health, and that it gave them an opportunity to, like with regards to the continuous health record and keeping all their information, etc., together, and they had some day-to-day usage out of a registry as well, that they would go on to be able to, that it would obviously encourage them to participate outside of simply just providing your information and then never hearing anything. And that is unfortunately been a lot of the experience for patients who have participated in any form of registry previously, is that you were initially requested, will you consent to join this registry? And you don't hear anything back afterwards. So you never really know how that information was used and how it's benefited anybody, if not yourself, in the long run. And that's obviously something that we would like to change. So thanks, Helen, for answering those two. I am seeing more questions coming through saying, with some of these RDs, there are no known treatments available. Will there be a mechanism to flag new treatments becoming available? This assisting pharma and treating physicians to collaborate in facilitating patients' access. Absolutely. I think that that's exactly what we're trying to do. We didn't want to have just another registry that tracks historical stuff. We wanted it to have a bit of a two-way element as well, where information could be communicated to patients that's relevant to patients. And we know that in the rare disease space, new treatments are becoming available all the time. And for a lot of those treatments, often patients, you might have been diagnosed 17, 18 years ago as an adult, as a young adult, and now you 50 odd years old and a treatment's become available, but because you're not actually maintaining or chatting to your doctor much, and you were told at the time that there wasn't any treatments available for you, there's very, very little follow through. And very, very often those patients are not reached out to be able to say to them, look, something has become available. So that is definitely one of the sticking points that we would like to overcome with using this and have it be a bit of a two-way information sharing exercise, which is why we have allowed for having static pages so that we can actually put that information in front of patients so that they can actually access information that's relevant to them. Then something coming through from Prof. Scholz. Thank you for the amazing work. I wanted to ask if your registry will translated into any of the other official languages. I'm just thinking about the Limpopo province, where a large number of patients do not read or speak English. So these are all things that we would love to be able to do. And obviously it all forms part of the long-term intention and ability, and that all comes back down to what we can and can't get funded. So would we like to see it available in a multitude of languages? Absolutely, we will. Because we know that it's going to be, it's absolutely critical, particularly for patients, to be able to engage on a regular basis with this information and to use this registry for the full scope that it was designed for. Obviously, accessing information in your own language is critically important. But again, finances are always the limiting resource. So the world is our oyster. If we can get it funded, we will certainly do it. I think that those are all the questions that have come through from now. I am just checking on this side. No, everything seems to be okay there. So I'm just going to give everyone a couple of seconds to see if there are any more questions coming through, but then also just to ask the question, if there's anybody listening to this call today who thinks that this might be something that they have an interest in participating with, assisting us from a funding and sponsorship perspective, or from a further development point of view, etc., to please reach out. Like I said, we have done things a little bit differently this time. This is something that's been designed by the patients for the patients. And we are wanting it to be a collaborative thing. So we didn't want to approach people exclusively, for lack of a better word. This is an open opportunity to say, this is what we're working on, this is what we're doing. How much funding we are able to get in and how much of the costs we are able to get funded will determine how rapidly we can roll this program out and how quickly we'll be able to make things available to the wider community. But that is hugely dependent on us being able to get the resources in. Someone has asked, what is the best way to make contact in regards to sponsorship or other opportunities to support? So the best thing would be to reach out to us directly. That can be done on my email address, which is info@rarediseases.co.za. I will be sending out a post when I send out the slides to all the registrants. You should be able to get that as well. You'll be able to get my email address off there, or alternatively, you can email our operations manager, who is Sharon, and her email is support@rarediseases.co.za. But that is probably the best way. We do have this funding proposal. I mean, we have written it up and it is there. It's easy to send out, but we didn't want to be approaching people on a piecemeal sort of mechanism, and we wanted this to be open and collaborative, which is why we opted to do it the way we have today. I'm seeing another question coming through. Historically, there have been cases where genetic research has caused discrimination against certain people groups, especially in rare conditions, simply because they are so rare. Even when the data is anonymized, it can be identifying. I am therefore very impressed by the notions of patients being able to approve use of their info prior to data sharing. Will this not be a very labor intensive though? No, the idea is that it won't be. It will be quite simple to do. The intention is that all the patients that qualify for that particular data research request will receive a prompt notification that says you have been identified. All the individuals, obviously from an identification perspective, it will be us from our team. And we generally have access to all this information already because these patients are registered members with Rare Diseases South Africa. But the intention would be that it would be a push notification. We could either do a search based on ICD-10 or symptoms, etc., regardless of dependence on what the data request was, and that all the qualifying members would then subsequently receive a push notification to alert them to the fact that they have been identified as possibly benefiting or wanting to request, and they would simply, it would be a simple clicking of a yes or a no in terms of providing information to that. Thank you very much. I'm seeing messages coming through saying that they would love to be involved. I don't want to announce who they are just in case they can't be announced yet, so I'll just be quite diplomatic about how I do that. but also commenting on the patient-centric approach. So thank you very, very much for the recognition there, right? And then also, would the mental health components include both caregiver and person with the condition? So that's a very interesting question. At this point, we've only really allowed for the patient, but there might be an element, it might be possible for us to actually do that, to be able to extend that to the caregiver as well. Understanding once again that, you know, how well patients do, you know, how well they are supported, and the mental health of those immediately around them, and the impact and the burden of disease that impacts the immediate family members and caregivers is fundamental in determining their patient outcomes. So certainly something that would be worth tracking. We might just have to consider ways in which we could do that, but definitely something for us to pin and to look at possibly developing further. I am seeing another message coming through here. There's some stuff coming through in the chats as well. Thank you very, very much. Janet is saying that they would like to be involved as well. They are one of our support groups, so we're really, really happy to hear that we've got the support of our support groups. But yeah, I think if there are no other questions, if there are, and you might think of something after you've received the presentation in your inbox, you know, you might need to speak to other individuals about it. If there are other things that you would like to, you know, discuss with us or ask us or collaborate on, the doors are always open. You know where to find us, and we'd be more than willing to entertain discussions around this. It really is. We haven't just done this. We know that the data is important and it drives the advocacy, but we also know that these patients need assistance in sometimes the simplest of things, and something simple like tracking your mental health and really getting an understanding of your pain scale, etc., is such a valuable thing in terms of treating the patient holistically. So we hope that this somewhat simple intervention might be of use. Another question coming through, Section 21 can be a bit tedious. Will there be a way to integrate this as well? I think you're probably referring to Section 21 applications. It's not something that we would have necessarily considered particularly to this registry, but we do have mechanisms in place to assist from Section 21 application perspective outside of just the registry. So definitely worth giving us a shout out about that. When it comes to Section 21, we know it can be a bit of hard work. All right, so I think that is it. I'm happy to have given everybody back some more of their time. I mean, we had set aside quite a significant amount of time simply because we didn't know how it was going to be received or how intense the questions would be. But a big thanks to everyone who has joined today and really just taking the time to get a little bit more information about what we've been up to. Proof indeed that we did work very, very hard through COVID, even though we were all working from home. We definitely were throwing ourselves into really getting to grips on what we could do to further improve our patient community. And we're really, really hoping that this is an opportunity to do so. And then obviously also just to say thanks to everybody for, you know, continuously supporting our initiatives. It certainly has been a very, very interesting few years, and we are really, really grateful to be coming out what seems like the other side of this pandemic, and really are looking forward to being able to sink our teeth back into rare disease patient advocacy once again, and really improving understanding the data, understanding the research a little bit better, collaborating, but I think most importantly, making sure that every single patient is accounted for in some way. So with that, I'm going to let you all go. Thanks so much once again. If anybody wants to reach out, they're more than welcome to do so. Worst case scenario, you can visit our website, www.rarediseases.co.za, and find our contact details there. Thanks so much for joining, everyone. Hope you have a lovely day further. Cheerio.